question about assisted dying can come from anyone at any time. It can come from a patient or a family member, and it can be addressed to any member of the healthcare team. So it could be a nurse in the middle of the night going in to check an IV. It could be a porter taking someone for an x-ray or for a test or a procedure. And it might just be an offhand comment that a patient makes, something like, "I just wish this was all over." And that is a signal to the healthcare provider that the patient may be suffering, and there may need to be some exploration of the comment to understand where it's coming from and what motivated it. A question or a comment about MAID is an indication that there is some kind of unmet need, and that the patient is either suffering or is worried about suffering in the future. And it means that the healthcare provider is somebody who the patient trusts. They are somebody who now has an obligation to respond in some way to that comment. So the role of the healthcare provider in that situation is going to be to sit down and talk to the patient and get an understanding of where the question came from or where the comment came from, what's motivating it, why the patient made the comment at that particular time, and what kinds of needs exist that haven't been met that the system might be able to help with. Conscientious objection is the refusal to provide a legally and professionally accepted good or service on the grounds of conscience. That is because it is contrary to somebody's moral beliefs. This is something that falls within the scope of professional capacity or competence. So this is something that people are able to do within their scope of practice, but they're refusing to provide that service on the basis that it is against their moral code or it's contrary to their personal integrity. Historically, in healthcare, we have tolerated conscientious objection for a long time in a variety of situations, mostly when it's a non-urgent or non-emergent situation and when there is another healthcare provider that's available to provide the service. For the patients that are asking for it, it's often a reflection of their desire for autonomy, a desire for control, an expectation that the healthcare system will respect their choices and their decisions on how they want to live their life. On the other hand, the values of the healthcare providers in the healthcare system, especially those who object or who are not comfortable participating in this, are things like providing benefit, doing good, avoiding harm. And so sometimes the conflict arises when the conception of harm is very different depending on the party that you're talking to. So for a patient, the harm might be prolonged suffering, and on the other hand, for the healthcare provider, the harm might be a hastened death. There's no obligation under the law or under the codes of ethics of most healthcare professions that a healthcare provider will actually participate in MAID. In fact, the law says that nothing compels anybody to provide an assisted death. On the other hand, responding to the request, responding to a comment, is an obligation. We can't just pretend that we didn't hear it. A healthcare provider needs to, in some way, literally or figuratively, sit down and explore that comment with the patient. There was a reason that the patient made the comment, and whether it was because they're experiencing suffering or because they're worried about suffering, that confers an obligation onto the healthcare provider to respond in some way. And even if the response is very simple, something like, "Sounds like you're having a really rough time right now," that response is essential. Conscientious objection is important because it promotes moral sensitivity. It gets people thinking about what they believe in, where they stand on things, where their personal line in the sand is, what their values are, professional and personal values are, and how those should and can be acted out in their practice. This also cultivates a certain amount of moral diversity in the world, and it recognizes the fact that there's going to be different opinions about assisted dying among the population, among patients and families. And there's probably also a similar diversity of views among healthcare providers. And so having providers whose views and values match those of their patients is going to be really important. One of the challenges with conscientious objection is that acting on an objection on the part of a healthcare provider imposes that provider's views and values onto the patient who's asked them. It's really important for all healthcare providers, whether you're in direct contact with patients or not, whether you're providing health services directly or not, to think really hard about how you feel about assisted dying, to think about where you stand on the spectrum, to recognize that assisted dying is a process that starts with a comment or a question or an inquiry and proceeds through to and beyond the procedure that results in the patient's death. So as a healthcare provider, you need to think about how you feel about all of those things, whether there's a point in that process that you're not comfortable participating, and where that point is, so that you know exactly how much participation you're willing to provide. If you're somebody who strongly feels that this is truly contrary to your personal beliefs and your moral integrity, it's going to be important for you to let your supervisor know so that your objection can be accommodated as well as possible. If you receive a request or a question or a comment about assisted dying from a patient or from a family member on behalf of a patient, it's an opportunity to sit down and explore the request, to understand the comment and where it's coming from, and to have a sense of what the patient's unmet needs might be. Most of the time, a request will signify that there are needs that haven't yet been met, or that there's suffering that the patient is experiencing or is anticipating. So as a healthcare provider, our role is to acknowledge that there's been a request or a comment, something simple like, sounds like you're having a really rough time right now. That might be all it takes to at least make sure that the patient feels like they've been heard. The next piece is to explore the reason for the request. And this may or may not be within your scope of practice, depending on your role on the healthcare team, your relationship with the patient. It might be that you can have a good therapeutic discussion where you sit down and say, tell me about what's going on for you right now. Tell me about what's made you decide that you want to talk about this. But it might be something like, this is something that I think we need to talk about. Do you mind if I tell your healthcare team? Do you mind if I tell your nurse about this? And then the third piece is to convey that request. So to make sure that the comment, the fact that the patient has expressed an interest in or has expressed questions about an assisted death, that needs to be conveyed to your supervisor and up through the chain so that it in a timely way comes to the MAID team to act on. The other option you have if you are not comfortable participating in the process of MAID is to provide the information on the MAID team to the patient who's asking so that the MAID team can contact them and do some exploration. One of the things that's concerning is that there may be healthcare providers who feel that any kind of participation, including referral or providing information to a patient about assisted dying, is so contrary to their personal integrity that they will feel like they're in a position where they have to choose between their profession, their job, and their values, where they are truly incapable of reconciling the requirements of their job with their values. And so I do worry that there is going to be an exodus of providers who truly can't reconcile those ideas. So if you're somebody who isn't prepared to be involved in the process of an assisted death, you still need to make sure that the request, the comment, is passed on to somebody who can be involved in facilitating access to the MAID team, providing the information that the patient needs, and in the meantime, addressing the suffering that's happening that's caused the request.